Yesterday, the provincial government expanded some of the health restrictions already in place in the Regina region to the rest of the province. Bubbles essentially are closed, and places of worship will have to shrink to a capacity of a maximum of 30 people on Friday. But outside Regina, for example, you can still dine in a restaurant or bar, and this is leaving many local doctors, especially those working in intensive care, frustrated. Dr. Hassan Masri is an ICU doctor in Saskatoon and joins me now. Thanks for taking the time today.
Thank you for having me, Sam.
First off, tell me about Saskatoon's ICU situation. How are you and your teams managing?
The ICU in Saskatoon is well under control right now. Our numbers are manageable, and our team overall, we feel the exhaustion that everyone feels. It's been a very long year and few months of hard work and restrictions and all the things that everybody has been feeling, and pandemic fatigue is obviously real, and healthcare workers are no different. But our numbers for now are manageable, but we are on alert for rising variant numbers in Saskatoon, and we are hoping that we would not be in the situation that Regina is in, but certainly with the rising numbers, we won't be surprised if that's our fate in the next week or so.
I know you've been pushing for more restrictions. What's your thoughts on the changes announced on Tuesday?
I think many of the things that were announced on Tuesday were great. I think it was something that we should have done a while back. Expanding the bubbles has really backfired here in Saskatchewan, and especially knowing that the variant was spreading quite aggressively in the province. So we're very happy to see that the bubbles have been restricted again. I think decreasing the numbers in mosques and churches and religious institutions is great. I would argue that that number should be even smaller. A spread or an outbreak of 30 people is a devastating outbreak. We know that there have been many outbreaks in the past in religious institutions. We want to protect the people of these religious institutions, and we don't want to see them sick. We don't want to see them in our ICUs. And this is obviously something that's very temporary. I think that the fact that the bars are still open is very problematic for me, and we really need to think about in-restaurant dining and whether that's a really good idea still when we are having a very easy to spread variant.
You were really excited to get your vaccination, but I know many other healthcare workers have opted not to get theirs. Why do you think so many people are hesitant?
I was indeed very, very excited. I think the numbers, I think the hesitancy comes from the fact that there's a lot of fear-mongering that exists out there, and there's a lot of misunderstanding of what things mean. So, for example, many people don't understand what efficacy means, and even within healthcare, and they think that waiting for a Pfizer vaccine is the right thing to do, or for Moderna, because the efficacy rate is higher. When in fact, these vaccines were studied in different populations, different time of the year. Pfizer and Moderna were studied in a time where there was no variant versus AstraZeneca and Johnson & Johnson were studied in a time where there was a lot of variants. And so perhaps if we were to repeat the Moderna and Pfizer study, we would probably find them in around the same numbers as the AstraZeneca and the Johnson & Johnson. So misunderstanding of what efficacy means is a big deal, and it's worsening the hesitancy among health workers and the general public, but also fear-mongering and fear in general. I mean, we're talking about these new, very rare episodic, instances of having a blood clot, 1 or 2 in a million, and there's a lot of misunderstanding of who's at risk for it, and what does it mean, and what does it compare to the fact that getting the disease itself in Saskatchewan or in Canada would be 50 times or 60 times more likely to lead to death compared to that blood clot. And that 16 or 20% of people who end up with COVID end up having really bad blood clots. So I think it's multiple factors. I think it's not understanding some of the facts and then mixed with a bit of fear.
Aside from vaccinations, what else do you think needs to happen going forward?
I think that we have seen what's happened in Quebec and Alberta and Ontario in terms of hospitals are on the brink of collapse. Healthcare system in Ontario is on the brink of collapse, and I think that there is an element of personal responsibility and personal sacrifice. And I know that people have been responsible and have been sacrificing quite a bit. But in the next, I think, 2 to 3 weeks, we really need to go above and beyond in protecting our cities, our people, our families, and ourselves, because this virus is spreading very quickly. This variant is making people really sick, and we cannot afford to, bring our own healthcare system in Saskatchewan to a point where it could collapse, where we have to cancel more surgeries, where we have to delay more screening of important procedures to screen for cancer, etc. There is a level of personal responsibility to make sure that we get out of this. The bottom line is, we believe, and many of my colleagues and I believe that we are not pro restrictions, we're not pro lockdowns, but we do believe that swift, aggressive, and science-based restrictions are the fastest way to have the least amount of restrictions in the near future.
All right. Thanks for your time and for your work, Dr. Masri.
Thank you so much for having me.
Dr. Hassan Masri is a professor at the University of Saskatchewan and an ICU doctor in Saskatoon.